Welcome to the 2026 Housing Navigation Center NOFA Pre-Application Conference. So today we're going to discuss the recently published NOFA for an operator of the Housing Navigation Center. We'll talk about the funding, we'll talk about an overview and some of the requirements, and at the end we'll have opportunities for questions and answers. To start, I'm Lindsay Broom. I work here at the Housing and Community Development Department as a staff analyst. I am on the procurement team and I mainly oversee NOFAs. So I will be your person to kind of walk you through the application process. If you have questions, I'm the person you can go to. All right, so just to kind of give you a start of an overview of what we're looking for here. The funding that we're going to be using for this NOFA is up to $10.5 million. 7.5 million of that is in development block grant disaster recovery, and that's 2024. And then there'll be 3 million in additional sources, which could be federal, state, or local funding. The contract that we are going to have will be over a 36-month period, and funds will be provided via monthly reimbursement for eligible costs, which we'll go over further in the presentation about what that means. So I want to go a little bit over the timeline. So the NOFA was issued on Friday, April 17th. So I hope that you have had time to look that over and kind of have a rough idea of what we're trying to do here. Today we're having the pre-application conference, and then I'm going to let Melody Barr, who's here with me, discuss facility tour.
Yeah, so the tour that was scheduled for Friday, April 24th has been canceled. We received a significantly higher number of RSVPs than anticipated, and out of an abundance of caution and concern for safety, we will reschedule for a later date. A formal letter of clarification with additional details will be provided soon. Please remember, this is an active shelter. So active operations are happening, and so due to that large number, we felt it necessary to cancel. So look forward to the clarification.
Yes, and if you've already RSVP'd, you will be getting an email from me later today, kind of just letting you know that we will not be holding that or hosting that tomorrow. The questions for the NOFA need to be submitted by April 29th at 5 p.m. And then the application, so your NOFA application will be due on May 8th by 5 p.m. All right, so without further ado, I'm going to have Melody and Jared kind of provide an overview of the scope for the NOFA and the meat and potatoes of what the NOFA contains.
All right.
Good morning, everyone. My name is Jared Briggs. I'm with the Public Services Division here with Melody and Lindsay. We're all in the same room, so the audio is going to continue to come over from Lindsay's computer. So if you're wondering why I'm muted, but you're hearing me, that's why. So this NOFA, we are seeking applications to not only operate, but the applicant will be the leaseholder of the Housing Navigation Center that's located at 2903 Jensen. This is currently a co-ed and what we like to call an easy entry and ADA accessible temporary shelter. The facility does provide semi-private accommodations and services for individuals awaiting placement into housing or other appropriate housing facilities or other service providers. Currently, the way the facility is set up, it has a capacity to serve 100 unhoused individuals with additional overflow space. And there'll be a picture later on to show you kind of like what one of the rooms looks like and the 4 beds per room. So the purpose of the NOFA, as Lindsay talked about earlier, we're seeking a qualified nonprofit or local government entity to operate the center for a period of 3 years, 36 months. And we're going to support that with approximately $10.5 million. That's utilizing federal, state, and some local fundings. The federal dollars are primarily CDBG DR 24 dollars. For the next slide. So the scope of services, what we're looking for in an operator. This facility, as Melody mentioned, is currently active and housing individuals. It operates 24/7, so you have to have 24/7 management. You have to be on site 24/7. You have to be able to account for safety, security, provide food to the individual staying there. The leaseholder will be responsible for maintenance inside the facility. It is a city-owned building, but the city is only responsible currently for maintaining the outside envelope of the facility, so anything inside will be the operator's responsibility. Also, 24/7 security is the expectation. For client intake and access, this facility currently operates with, it's not a walk-up facility. It has clients are referred or dropped off by law enforcement. So it's a referral process with limited access. We also have limitations on who can be there due to some of the surrounding land uses. There's a daycare across the street. And the operator is expected to, work with the individuals and provide services, in a dignified manner and ease them into that facility. The services, again, meals, at least, 3 meals a day. It is very important, if you're not familiar with the building, that there is no on-site kitchen. So meals have to be brought in off-site. The operator is also expected to provide for the clients, help them with their hygiene, supplies, clothing, pet care if they have pets, and pet care, pet accommodations, health services, and other on-site activities, daily activities to keep individuals busy that aren't leaving or going to a job or other services. We also expect behavioral health and clinical integration into operations. So coordination with behavioral health service providers, that could be in the form of other peer support for individuals needing some form of crisis response or other services that are needed. There is also currently on-site clinic that is operated by Harris Health in one part of the building that primarily deals with medical needs. The housing and diversion pathways. So for the individuals coming in, this is not like to be their permanent home. We're looking for individuals to move on to, be rehoused into available units. And the operator is expected to perform assessments as needed, provide permanent housing options, work with other agencies. And that leads into that the item F, coordination and system integration. So everybody in here will be at HMIS. They'll participate in coordinated entry, looking for placements. And of course, the operator should have an extensive list of partner agencies that they work with and, for services, for housing. One of our big system lead, our lead agency is the Coalition for the Homeless. Another thing to be aware of is this facility, we do, again, 24/7 operations. You have to be expected to operate during disasters and or be able to surge to house additional clients above that 100. So we would expect to see emergency plans. What are your options to keep the facility running? Backup power. How would you coordinate with the Office of Emergency Management during an event? Transportation for residents. That can be either provided directly by the operator if you have your own vehicles or indirect methods through, say, Metro or other contracted transportation. So we would like to see that in the proposal. And then for compliance and reporting, you will be expected to provide monthly reports. Again, all the data, client data is going to go into HMIS, but we also want to track client outcomes. Everybody that receives funding from the city is subject to at least one annual monitoring visit. And as well as we'll be tracking, overall performance, how long individuals are staying, and then the data quality, what you're putting into HMIS, what you're reporting to the city. We want to make sure that it is good quality data so that we can use it to analyze and see, how we can improve performance. Next slide. All right, the facility, again, if you're not familiar, the address is 2309 Jensen Drive, Houston, Texas. It's on the near north side. The capacity, 100 single adults, we have 4 beds per room currently. And so this is serving individuals that are experiencing homelessness that are referred to the facility, not walk up. And again, it's owned by the city of Houston. This is just a rough outline of the boundary of the property from Google Earth. You can look at it, pull it up yourself. Again, it's north of downtown. It's just west of I-69. And north of downtown, and it's primarily residential with some light industrial around it. And again, that one building directly to the right, that kind of shaped like an L, that is a daycare facility. So we do have to keep that in mind. We are trying to be the operator to be aware of the surrounding neighborhood, and that also limits some of the type of clients that can be housed at the facility. Next slide. So here's an example, just a real quick picture. If you're not familiar with what one of the rooms looks like, this is one of the exterior rooms. So you can see that there's some windows. When we get to the floor plan, we can point these out. There are some dividers that are an option for a little bit of personal privacy, but there's 4 beds per room. And that's, it's pretty much it. It's cinder block walls, it's concrete floors. It is, to provide a space for individuals that is safe and it's not on the street, and to where they can get services and hopefully, move on to a permanent housing option. So quick overview, we do have, these are part of the NOFA as one of the attachments. This is a floor plan of the entire facility. So this would be kind of the bottom of the picture would be you were coming in from the parking lot. So you have a main entrance and you have this hallway that is at the front that wraps around to the right. You've got some office space and other areas along the far right side of the building. There's also in that corner is where the clinic is currently located. The 2 large rooms, the one on the right is currently used as more like a storage and overflow capacity or meeting room. The one in the middle is currently used as like a day room with tables and chairs, as well as also where meals are served. There is some additional classrooms in the back and then a large storage space behind the day room. And then everything kind of on the left half of the building, that would be where you have your restrooms. You've also got some small offices, and then you've got all the dormitory spaces, and your washers and dryers are on the far left end of the building, which also has like a glass curtain wall that opens up to the outdoor recreation space. Next slide. So yeah, this slide zooms in on that kind of left half where the residential spaces are. You can see you've got, 1, 2, 3 hallways. And some of these rooms face the exterior of the building, so they do have windows. And then the ones that are on those interior hallways are they're just rooms, no windows, with a single door and 4 beds per room. And this is showing the right side of the facility with the day room. There is some offices that are great for meeting with clients, and I believe that's what they're currently used for, between the day room and then the smaller overflow room. So there's space there. We're going to have, as part of, even though the tour was canceled, we are looking at putting up some additional photos later on before the NOFA closes for anybody that's not familiar with the facility. You can go to the next one. Do you want me to go over threshold?
So our threshold items, so as you apply, this is what we're looking for. If threshold is not met, then the application is no longer reviewed after the threshold. So that's the first review that happens. So you cannot be debarred or suspended, federal, state, or local. Must be in good standing with the city of Houston. Be current on your franchise tax account status. So if you're unsure, please look it up. Have a current 501c3 status or similar documentation for a unit of local government. 5 years experience operating a residential facility, shelter, or congregate facility. Must be able to document effective partnerships with health, behavioral health, and housing agencies. Have a 90-day operating reserves, and I'll come back to that in just a second. Ability to begin operations July 1st, 2026. Uphold an easy entry with minimal restrictions approach. And insurance coverage for current operations. And so that insurance coverage is over the building, the land. When we go back to the 90-day of operating reserves, so this is really going to be dependent on what your budget looks like. So whatever you're submitting for your budget, you need to be able to provide us with 90 days or 25% of your reserve. That reserve needs to be a single account dedicated to this project. And so, for example, and I'll just say, like, if we're seeing that it's approximately $250,000 a month to operate this facility at current status. And so that's about $750,000 that you're going to have to provide to us in the form of a line of credit, in the form of a separate account that is specific to this project. Next slide. So the scoring criteria is listed below. So we're looking for organizational management, which is worth 15 points. Did we go into that? I'm sorry, I didn't prepare. Do we need it on this slide? Do we want to go into this, or is this later?
No, I think this is the only scoring criteria slide.
So. Okay. And so you can kind of, he's going to back me up. All right. So organizational management is 15 points. Targeted services, 20. Cost reasonableness, 10 points. Budget effectiveness, 10 points. Data-driven evaluation, 10 points. Experience and past performance, 15 points. Leveraging contributions, 5 points. And agency collaboration, 15 points. And then do we have the NOFA in front of us? by chance?
We don't.
Okay.
And yeah, this criteria is much more detailed in the NOFA document where it helps to guide you on what we're looking for. Organizational management has to do with, we want to see like the structure of your agency, the structure of how you're going to run the facility, what staff are you going to dedicate, how is that org chart going to flow, how is it going to fit into the larger operations of your current organization. Targeted services, how are you going, what are you going to do for the clients, what services are you going to provide, and how, the meals, security, the mental health, any other services, case management, the cost reasonableness, of course, we're going to look into what's your budget. Does it align with your scope and what you're proposing? Do the costs seem reasonable? If you're asking for, $5 million a year, that's pretty high, but you have to have justification. Are your salaries in line with, kind of the industry average? If you do have higher costs on something, we would expect to see some type of note or justification. That's always very helpful to explain why you might be outside the industry norms or something is, very high cost for your proposal. The budget effectiveness we're looking at, is the budget accurate? Is it complete? Do the calculations, does it add up? In addition, is it aligned with the scope? Is everything that you say that you want as part of your scope in your org chart, or all those positions listed in the budget? Are they accounted for, whether they're going to be asking for funding from our organization to support them or your leverage? We need to see where that funding is coming from and how each position is supported, as well as are your line items. We expect to see, to give you an example, you can group, say, case managers. You don't have to list out every single case manager. You can do a line item for case manager and do like 10 FTEs, but don't consolidate everything into like just operations on one line. We need to see it broken out of your staff. We need to see the fringe cost. We need to see if you have different positions. We would expect to see at least one line item for different positions. So maybe case managers, shelter, like maybe floor staff or shelter lead, or facility director, or whatever other staff. If you're going to have in-house clinical people, those should be listed. Or if you're going to contract those services out, we would expect to see a separate line item. If you're doing something like a contracting security or a food vendor or some other service, linens or maintenance, you need to explain all that and put, funding, what you think that's going to cost. The data-driven evaluation, we want to see how you're going to evaluate your program performance. Do you have experience? Show us with what data you're going to track, how you're going to, review your client intake, your outcomes, how are you going to track your performance? Does your organization already have some way of going in and like evaluating themselves every, couple months? What do you use? What kind of software do you use to help track either your billing, your client information, or both? I will say we do prefer to see an agency that has some form of software that they use for their staff and payroll management. We're trying to move away from handwritten records, something that's easy to export. So you will be submitting a monthly reimbursement request as part of whoever is selected. Your experience and past performance. I'm not remembering the exact criteria that's in the NOFA right now. Do you want to say it, Lindsay?
Yeah, I have it pulled up. So here we're looking for examples of similar facilities that you've previously operated, including, the square footage, operating hours, just how similar they are to this current facility. That even includes, average length of stay and client outcomes, description of your intake and access processes, description of essential services, the meal services you provided, and then also your experience with behavioral health and clinical integration. So what we're looking for is just basically what have you done before that is similar to what you're doing now.
Yeah, and we're looking for an operator that can. The goal is by July 1, one of the criteria to be ready to take over by July 1. That is what we're shooting for. With the current agreement with the current operator is set to expire then. There is a little bit of wiggle room in there if needed, but we want a seamless transition. So we need an organization is what we're looking for that can come in and take over operations and provide a seamless transition from the current operator and ensure that there's no disruption in services or operations to the clients. So it's very important that you have some experience in operating a facility of this size and of this type and offering these services to individuals that have been homeless, and you're helping them transition back into, hopefully away from the trauma that they've experienced on the street, to back into housing and a more stable lifestyle. The leveraging contribution, maximum of 5 points. We just want to see if you have other funding that you can offer. I don't think it's not a threshold item. You don't have to have leverage. We understand that this is, an expensive project to operate. But if you do have other funds that you could utilize to help support, please list those. And again, that should show up in your budget as well. And we would need to see documentation of what that leverage is. Do you have a philanthropy? Do you have a grant that you could apply? We would want to see documentation of that. And then the last one, the agency collaboration, which I know I alluded to very earlier, is very important. We want to see I think we say the letters or MOUs, MOAs, or LOAs, whatever you may have. And I believe the criteria, did we say less than?
They need to be active.
Active, less than 90 or less than 1 year old. I can't remember what we put in you have it. Did we put a date on it?
We actually didn't put a date on it.
Okay.
So, but they should be active, right? So if this is an MOA that you have or MOU that you have from 5 years ago, you're like, oh, we still use this. If it's not an active with a term date, we're going to ask for that, or we're just not going to consider it.
We say non-expired, so basically active. Right. That's the last one, right? I want to say one thing about the threshold and just how the process works. So these threshold items, you will be required to provide documentation to support each one of those. And those will be, the documentation that you need will be listed on the application checklist. So what happens when they come in is I do a threshold review and I make sure that all the applications meet these thresholds. If you do not meet the threshold, you will not move on to scoring. So you really need to think about these and make sure that you qualify before you begin and spend time applying. I don't want you to, waste your time because it's very difficult to get applications together. So just make sure you really read this list and that you have documentation to back up each one of those threshold items. And if you have any questions, one thing I wanted to mention about the budget, we also provide a budget template, and that is part of a budget effectiveness that you use that template that we provide and that you fill it out correctly. So that is available to you. And if you have any questions during the question period, please let me know. Okay, all right. So next we're going to talk about compliance requirements. And then at the end, I will talk a little bit more about what it takes to apply and what you need to do. For compliance, we have Ms. Lakeisha Tate.
Good afternoon. I'm Lakeisha Tate, and I will be providing the City of Houston's Pay or Play program requirements for the 2026 Housing Navigation Center NOFA. The City of Houston Pay or Play program, which is governed by the Executive Order 1 through 7, and the purpose of the City of Houston Pay or Play program is to require certain vendors, subcontractors to provide certain employees a minimum level of healthcare benefits or to contribute a designated amount to be used to offset the cost of providing healthcare insurance to uninsured people in the Houston and Harris County area. Next slide. So any contract agreements valued at or above $100,000 or any subcontract agreements valued at or above $200,000, this is including any contingencies, amendments, or supplemental terms, will be required and will be subject to be a covered POP contract. That means any professional services, if it's construction type or any type of service type contract agreements will be considered a covered contract. Next slide. So what is considered a pay or play covered employee? The program applies to employees of a covered contractor or subcontractor, including contract laborers who are over the age of 18, work at least 30 hours per week for that contractor or subcontractor, and with any amount of time under a covered or city contract or subcontract. Next slide. So one of the options for the City of Houston Pay or Play program is the pay option. If a POP covered contractor elects the pay option, the contractor will pay by contributing $1 per covered employee per regular hour for work performed under the contract with the city. So that means covered employees who are over the age of 18 work at least 30 hours per week with any amount of time on a covered city contract or subcontract can be considered and use the pay option. These funds are deposited into the Contractor's Responsibility Fund used to offset costs for providing health care to uninsured people in the Houston and Harris County area. Unfortunately, the employees for the pay or play covered contractors or subs will not receive $1 per regular hour for work performed under the contract with the city. Next slide. If a contractor or subcontractor decides to be a play contractor, that means they will elect the play contractor. They will provide health care benefits to covered employees. The health care benefits must meet or exceed the city following standards, which says that the employer will contribute no less than 75% per covered employee per month toward the total premium cost. And the employee contribution, if any amount, will be no greater than 25% of the monthly premium cost, and that's single health care coverage. Information regarding the City of Houston's Pay or Play. OBO provides Pay or Play related help documents, Pay or Play forms, and all related Pay or Play related updates through their website at www.houstontx.gov/OBO/popforms.html. This concludes the compliance requirements portion as it relates to the City of Houston Pay or Play program. Thank you for your time, and we're excited about the opportunity to collaborate with you.
Thank you, Lakeisha. So next we have Chris Robinson to talk us through the complaints and appeals process.
Hello, good morning and almost afternoon in about 2 minutes. Again, my name is Chris Robinson, as Lindsay said, and I'm going to walk through the complaints and appeals process. Next slide, please. All right, so there are 2 types of grievances that can be filed here at HCD. There's the complaint and then there is the appeal. So a complaint is typically about any HCD operation, whether it's about how long we're taking to process an application, or if you need a status update because you haven't heard anything, you have concerns about our program requirements or anything of that nature, you can send in a grievance to us, and we will respond within writing within 15 days to let you know some type of information, whether it's we're providing you a status or a reason why the program requirements are written as they are, or some other piece of information that may help you understand our operations process, or if we needed to actually resolve an issue for you. Now, there is the appeal. This is for a program determination. So only people who are applying to a program can submit an appeal, which is different from a complaint. Anyone from the public can submit a complaint. And appeals can range from anything from not getting an award to a procedural error during reviewing your appeal. Typically, they have to be submitted within 30 days of your determination. However, NOFAs are different. You are required to submit your appeal request within 7 days, 7 business days of receiving your determination letter. And then we will also respond. It's 5 business days for you to submit it and 7 days for us to respond with the written response. Next slide, Lindsay. All right, excuse me. As I was saying earlier, any member of the public can submit a complaint. Program participants can also submit complaints, but appeals are reserved for program participants or applications. If you are filing either one of these grievances, you will have to include your first and last name, your address, the name of the project, NOFA or RFP that you're complaining or appealing about, and your contact information, whether it's a phone number or email, and what you're actual reason for the complaint or appeal is. So we ask that you be as detailed as possible so that we can investigate properly. Next slide. All right, so there are two main tiers for appeals. Tier 3 appeals are reserved for state-funded projects. That is not happening here, so we'll only have 2 tiers. So if you do file an appeal and a request, and that request is accepted, we'll process your appeal. The program area will be the first to respond, to review and respond to your complaint, or sorry, to your appeal. If you feel that their response was not sufficient and that you think that the decision should be overturned for whatever reason, you can file a Tier 2 appeal. At that level, an appeal review committee will convene, review all of the information that has been pulled during the investigative process, and then they will make a determination, and the appeal team will provide a written response to you. So as I was saying earlier, appellants must file an appeal request in writing within 5 business days of receiving your determination letter. We typically acknowledge receipt of that request within 1 business day, and you will have 5 calendar days from that date that you submit to submit any supporting documentation that you think may be helpful during the investigative process. Within 7 calendar days, it really should say business days, sorry, of receiving that appeal, that accepted appeal, the program area or the appeal review committee has to make a determination, and we will provide an actual determination letter to you or an email. It is worth noting, excuse me, a couple of things. If we don't receive any appeals within that 5 business day time frame after determination letters have been sent out, HCD will proceed with the funding announcement. So after that time frame, appeals will not be accepted for this particular NOFA. And then there are 3 grounds for appealing NOFAs. There's only 3. So if you do not receive an award, you can appeal. If you disagree with the award calculation or award amount, you can appeal. If you have been deemed non-responsive for not meeting the minimum threshold or not responding to each of the scoring criterion, you can appeal that. However, if you receive a non-responsive letter from the NOFA team stating that you missed the deadline or your application was late, or there were critical documents not submitted prior to the deadline, that type of non-responsive application will not be permitted to appeal. So even if you submit an appeal request, we will not accept it and we will not process your appeal. I think that's it. Next slide for this slide. Next slide, Lindsay. That's it for me. Oh, yeah. So if you need to contact us, you can call us at 832-394-6200 and select option 1. You'll get one of the members from the complaints and appeals team. You should email or mail in your appeal request to HCD complaints appeal@houstontx.gov, or mail it to our office at 2100 Travis at the 9th floor. And again, if you have any questions, my team is here to help, and feel free to drop any questions you might have in the chat. Thanks.
Thank you, Chris. Okay, now I'm going to walk you through how to get to the NOFA and how to apply. So if you go to houstontx.gov/housing/funding, there you'll find all our funding contract opportunities. So if you click on, so right now you can see there's a box that says featured NOFA available. If there's no NOFA available, that box will not be there. So you click on featured NOFA available. And this box will open up that tells you, a summary of the NOFA, the key dates that you need to know. As we mentioned earlier, the facility tour has been canceled, so that will be removed. But if we are to schedule something else, this is the place where you can go and check and see that. And then there should be a box that says View NOFA. From that View NOFA, it takes you to our central purchasing, or our strategic purchasing department, their website called Beacon Bid. Now on Beacon Bid, so that's the next slide, you will see our NOFA, but also on Beacon Bid, you can see all solicitations from the city at large, so not just HCD. So if you're interested in other opportunities with the city, Beacon Bid is a good website to bookmark so that you can see those. But if you click on View NOFA, it'll take you directly to our 2026 Housing Navigation Center NOFA. Here you'll find all the important documents, the NOFA, the budget, the attachments, any letter of clarification that we issue. So I suggest doing that now before you even start applying so that you can get notifications if we upload letters of clarification. If you're already not signed in, like if you're not already signed in, then you hit that Get on the Interest List box. And then we start submitting. So when you get on the interest list, what happens is that you receive it. Well, first you put in your information, put accurate contact information because this is, where it's going to go, and use the email address that you check often. Once you put in your email address, you hit submit, and then you will receive an email. That email has a button for you to download the application package, which is all the required documents and everything you need, and then also a link for submitting your response. So at that time, you're probably going to download documents first, right? You're not going to be ready to submit. You download your documents first, and then after you've downloaded the documents, you've completed all your required information, your application is ready to go. Now it's time to submit. So when you go in to submit your application, you're going to be prompted for several things. Number one is your contact information. And like I said, I think it automatically populates whatever you signed up with. So if you need to change that based on who is the best contact. So let's say you apply on Friday and you know that the next week you're going to be out of the country and you're not going to have access to email. Please don't put your email as the primary contact. Please put someone's email that I can reach, because when I do threshold review, that will have a timed limit. So you don't want to miss an email where I ask for additional documentation or something like that, because then you could end up not meeting threshold and not having your application scored. So please just make sure that you use an email and you put a contact information where it'll be easy for us to contact you. Then you move on to your threshold documents. And as I explained to you previously, for each threshold requirement, you need to supply documentation. And you can see on this screen that it has, T1, you cannot be debarred. And so we're asking like, hey, we need an active sam.gov registration. So that's what you put there. So that will be true for each piece of threshold requirement. You'll have a document to upload. Now, if you are reading through this and you do not understand something, please reach out to me and I can explain to you what to provide there. But again, do not wait until the last minute. Our question period ends before the application's due. So for substantial questions, those have to be submitted, I believe, by April 29th. So make sure you read through this ahead of time and you come up with your questions. That being said, if you have some technical issue with the Beacon Bid or you're having trouble submitting your application that last day, I'm always happy to answer questions like that, even up until the last minute. After threshold, you'll put your application documents. So this is like your narrative, the things that you say you're going to be doing, how you're going to address those scoring criteria. All the things that you basically are going to be scored on. So you would upload each one of those documents. Please, I'll address that on a different slide, but I do prefer that you use PDF when available. We do have the budget, which is required in both PDF and Excel, but PDF is preferred. And then finally, we have required forms. So just make sure that you submit all those required forms. And most of these are required, meaning you cannot submit the application until you upload something in that spot. But the other thing I'll say about Beacon Bid is that you are able to come back to it. So you can start your application, you can leave, and it will remember where you were. So that's a nice feature that you can start, upload some stuff, come back, a little different than our previous system. That being said, I still recommend starting early. Do not wait until the last day to try to submit everything because inevitably something goes wrong. So I would start the day before, get everything together, and then that leaves you with that last day in case there's something you missed. There will be an application checklist available when you download your package and use that application checklist. It tells you every single document required. So I would just print it and check it and make sure that you have everything before you even go into Beacon Bid to submit. And like I said, the preference is having everything in PDF except for budget, which will be in Excel document. Both, the budget will be in Excel and PDF. And you can, in Beacon Bid, you can upload multiple documents for each requirement. If you do that, it's my preference that you name the documents in something that I can understand. Sometimes I have applicants upload a lot of documents and it's very difficult for me to figure out what document is what. So if you could just be cognizant of what you're naming your documents, that would be helpful for me when I'm doing threshold and reviewing your application to make sure everything's there. It's just easier if I can clearly see, okay, this is their, tax return or something like that. And okay, some other tips is make sure you read those scoring criteria. In this NOFA, we have a scoring guide, so it tells you exactly how you're going to be scored. Read the scoring criteria, read the guide, and score yourself. And make sure that you're addressing each thing and you kind of have an idea in your mind of what you might score even before you submit. Make sure you provide all your threshold documents. I do allow, a cure period for threshold documents. So if I receive your application and I'm looking through it and I'm like, oh, it seems like this is the wrong document for their 501c3, I will reach out and ask you to submit the correct document, but that always comes with a time limit. Usually it's 3 business days. It may be 2 business days in this case because it's a shorter advertisement period. I don't know, but just make sure you have that you check that email so you can quickly respond. Be clear and concise. We didn't put any page limits on this, but I do feel like it behooves the applicant to be clear and concise because sometimes the more you write, it's a little bit more difficult for the evaluators to pull out what they need. So just stick to the point and avoid any unnecessary content if possible. And then please review the letter of clarifications. Those are viewed as part of the NOFA. So anything that is published in a letter of clarification, you are responsible for reading and including in your NOFA. So if we clarify one of the requirements, then you will be held to that. So make sure you check those and read them. Finally, I'll talk about the no contact period. So basically, anybody at your organization, any applicant and any of the representatives are not allowed to influence the award decision. What does that mean? You can't give any gifts, favors, or anything of value to a city employee, especially a city employee who will be making the decision about your award. So that includes anybody in HCD at all at this point. So no attempting to sway the award, and all questions must be directed only to a city representative. In this case, that's me. I'll put in the chat our email address. It's hcd_NOFA@houstontx.gov, and that's where all the questions should be. You may know, Jared and Melody from working with them and feel comfortable with them, but I would prefer, or actually you have to send your questions to me rather than to them. If you send it to them, they're just going to forward it to me. And that's just so that we can be fair and transparent, and that there's not even an appearance of someone having any influence. So just send all your questions to me, and if I do not know the answer, I work very closely with the public services team, so I will reach out to them and get your answer. The no contact period begins the day that the NOFA was issued, so that was actually Friday, April 17th, and it doesn't end until the award recommendation goes to City Council. So that's kind of a long period. So just be aware of that if you have questions, even about status updates, all those come to me and I will get those answers for you. That doesn't stop you from speaking publicly at that City Council meeting. So you are free at any time to come to that City Council meeting and make your public statement after the official selection has been made and placed on the agenda. Oh, there's the email address right there, hcd_NOFA@houstontx.gov. Okay, I know that was a lot of information, but we wanted to open it up for questions. I know we have some in the chat that I think Melody and Jared have been answering, but if anybody wants to just unmute themselves and ask a question, we're open to that as well.
Or raise their hand.
Or you can raise your hand, yeah.
Hello.
Hello.
Hey, yes. My name is Ken Lindsay, and I'm a local business owner. And what I wanted to know, my question was when they opened the facility and started housing the individuals, are those individuals gonna be able to go and work at any type of companies or organizations once they get housed?
I don't understand your question.
Okay, so you're going to be housing people at this location, right?
Go ahead. Yes, this is an active site already, so people are already housed there.
Oh, they're already housed there. Okay, I'm sorry. I just from what the email I have is that it's a new facility y'all opening up on Jensen Drive.
No.
And yeah, so I didn't know it was already open.
Hello.
Hello, I have a question.
Yeah.
Can you hear me? My name is Ashla Glass, Glass House Foundation. Are you all able to hear me?
Yes.
Okay, thank you. I'm sorry, I did get on the chat late. I got on the meeting late. I apologize. So with the application, I heard you say if we have any questions, we could reach out to you. What is your name, ma'am? Barbara, Miss Mel, let me see.
Lindsay, it's you.
Is it me?
Yeah.
Oh, I'm Lindsay Broom.
I'm sorry,
Lindsay Broom.
Miss Brew. Okay, you said that we're able to reach out to you if we have any questions during the application process. I will need to be able to reach out to you. Is your information included in the email that I received?
Yes, her information is included in the NOFA. So when you read the NOFA, it'll have the contact information there.
For you, okay, perfect. And the other question is, we already have a day shelter going, Glass House Foundation, which is off of Hardy and Little York. But due to city fees and things, we were not able to make it into a full-on shelter. We have a facility in which we are helping individuals. So we already have our feet wet. We're in the game. We're doing the work. And my question is, we are able to hire people, because I think I heard that, of course, it's going to be 24 hours a day. So we could hire individuals under our organization to do the work there.
So that is something that you would have to address in your NOFA, and you would
Okay.
tell us in your application what you're going to do.
Okay. I'll wait and hold any other questions until I go through it all. But I appreciate you. Thank you so much. Let me go to that email and make sure I have your information. Just in case, ma'am, may I get your One moment. Let me go. I would like to text myself and then I'll be done. What is your email address, Ms. Brew?
I'm putting it in the chat right now. It's
Thank you.
it's HCD.
Oh, it's in my email.
Yeah.
Okay, I see it.
Yeah.
All right, I won't bother you again. I'm done. Thank you.
Yeah.
Thank you.
Hello, I've got a quick
Now, hold on.
question. Can you hear me?
I have two hands up, so if you can go ahead and put your hand up, we'll call you in order. And so the first one we have is, I believe, Latanya Portia.
That is correct. Hi, my name is Latanya with PRK Foundation. I wanted to ask, what are the biggest operational breakdowns you've seen in similar facilities, like the one that's currently operating?
Can you clarify that?
Like from an operational standpoint, the breakdowns meeting reporting systems that are already in place. Was it the staffing structure? Basically, what differentiates like your strongest applicants from ones that you've seen in the past in relation to operational breakdowns?
Okay, so I think the piece that is, I guess, confusing me a little bit is the breakdown. What I can tell you is that our previous operator, our current operator, is a very strong operator. And the leaseholder itself is just wishing not to continue the lease. So there wasn't any type of, I guess, operational breakdown. The challenges, I think the largest challenge would be if you're working within our homeless system. I think everyone would agree the largest challenge right now is finding affordable housing, specifically for those that have high barriers. But that, I mean, in terms of operations, I don't have anything that I can talk about as a breakdown or anything like that. I mean, there's always room for improvement, but we've had some very strong operators. We've been very fortunate.
Okay, and if I can ask one more quick question, the funding, is it milestone based, reimbursement based, or performance based?
Yeah, as mentioned earlier, it's a reimbursement policy. This is a federal grant, and it's every applicant is required to have a 90-day working capital.
Okay, thank you so much.
No problem.
That's all.
Okay, number 2, I believe this is Deidre. Is that right?
Yes. Yes. Hi. I just wanted to just make sure I didn't hear correctly. So tomorrow, are we still meeting, or were you just making a comment about the visit?
No, we will not be having the visit tomorrow. The tour that was scheduled, I'm just gonna repeat, I put it in the notes, but the tour that was scheduled for Friday, April 24th has been canceled. We received a significantly higher number of RSVPs than we anticipated, and out of an abundance of caution and concern for the safety of those residents that are currently at the facility, we will be rescheduling at a later date, and we will issue a formal letter of clarification with additional details that will be provided soon.
Okay, great. Thank you.
No problem.
Bye-bye.
Thank you for asking that.
Thank you.
All right. Anyone else?
I think there was one that we did not get to in the chat. That was, is there a leasing amount for the building?
Well, we have the new house pathway. There's not a name.
Okay. Right, can the person from Any House LLC Pathways, did you have a question?
So the question related to the lease, that will be addressed formally in a letter of clarifications. And that's because I need to just run that response by our city legal. And I do see your hand up, Any House, but if you can unmute yourself, we can't hear you if you're speaking. There you go. I can hear you now.
Okay, thank you. I'm sorry. My name is Ebony Hughes. I am with Pathways to Stability Housing in partnership with Any House Consulting. And one of my questions is, are subcontractors or partner organizations allowed to support overflow housing or specialized populations?
Can you ask that in a different way?
Will subcontractors be allowed to partner with maybe someone who is getting this contract and apply?
So as you apply for this application, or as the application is made, that information would be given to us by that applicant. Like if that is their interest and there is a way for you to support that, then they would put that in the application.
Okay, thank
Yeah.
you.
So you need to develop that partnership yourself, basically. If you knew someone else who was applying and they wanted to include you in their application, you can do that, but you would have to develop that relationship yourself and that agreement, if that makes any sense.
Makes sense. Thank you.
And I know some people have contacted me in the past week or the past few days actually about partnerships and services that they provide that they think would be helpful at this facility. So the best thing to do in that case is once we select the operator, that will be, announced publicly via public notice. And then, nothing prohibits you from contacting that agency to talk about partnerships and, subcontracts or anything like that. You can reach out to them directly. At this point, we don't know who the operator is, so we can't really speak about anything beyond that because we don't know. So hope that answers some other questions that I got this week.
Thank you.
Yeah.
All right. Any other questions?
Okay. Well, if you think of a question after the call, again, I've put my email in there. That's the best way to reach me, and we'll get you an answer. So we appreciate everyone joining today, and we're excited to see the applications. Again, just a reminder, there will not be a facility tour tomorrow. So please don't, show up there because you won't be able to enter. So thank you. Oh, yes, actually, if you are looking for any partner services, you can drop those in the chat. It's a good idea, Yolanda. So yeah, anyone's free to do that because you'll have access to this chat after the call.
Well, thank you. Thank you very much for coming.
All right. Thank you, guys.